Over the years, during my time as a fellow at UAB and now working as an oncologist at Montgomery Cancer Center, we have realized that patients want to get treatment close to their home, being surrounded by their loved ones. And that is what we do here at MCC. From the time the patients walk in through the door being greeted by our lovely volunteers, to the time that they spend in their infusion chair with our treatment nurses, we provide them with a comforting environment close to their home, surrounded by people that are part of their community, and with a team that they can rely on.
And it's just right here, literally in our backyard. And it's just been so easy to be here, to get home.
It was so easy for family to help me get to my treatments. My sister in particular, it was so easy for her to drive me up, drive me back, get home and get rest, versus to having to worry about hotel expenses or worrying about anything else. They assisted with my gas as well. So that made it a whole lot easier and took a lot of worry off of me.
I've been able to pretty much continue to work through my treatment as an architect, and I have been able to participate in events and not miss out much. This experience has not robbed me of the joy of being a mom and seeing my daughter grow and meet every milestone, so I don't feel like I've missed much in that sense.
Being able to go to work and then have treatment and then go home and be in my own bed at night is really important.
When I call, if there is something going on, they answer, they get back to me immediately. I can be right back over here if I needed to be. It's just very, very convenient and very nice to have.
We are accessible, and it's financially smart and sound to sometimes come here and get those treatments, and you're going to get just as good a care here as you would anywhere else. Our facilities and everything, they are second to none.
I did go to MD Anderson for a second opinion, and as well as UAB, I should say that too.
And I did get to speak to other professionals in the field, and they told me this is exactly what I would have done.
So we never felt like we had to go any further than Montgomery, Alabama, that I was in the best care I could be in already.
It's helpful and reassuring to a patient to go off to another state, to a large academic, well-respected medical center, and say to them, what he said is what you need to do. And so when they come back with that kind of result, they're all in. Then they say, hey, thank you for being respectful of my need to get a second opinion, but now I even have more trust in what you're telling me.
For me, the cancer center, them having the same chemotherapy recommendations as they had in Houston and being able to do that here was huge for me. I mean, having that locally and then getting done with the treatment and get to go to my own home to recover from all that was what made my treatments a whole lot more manageable and easier to do week in and week out.
Oftentimes, modern day cancer therapy is very intensive. It may involve treatment every week. It may involve getting lab work and x-rays on a regular basis, and having to go out of town for that is very difficult. So it's very important to be able to have that done here in Montgomery.